Hello everyone, I'm Hafiz.
And I'm Parkson.
We are the fathers behind the podcast We Are Dads Too. We discuss everything from being an effective father to a good co-parent to our spouse.
We also have guests and experts on our show to talk about the different aspects of fatherhood. Come and join us to discover more about our experiences as fathers because
We are Dads Too. Click on the link below to follow us on Spotify.
Well, we have Dr. Taufiq back again, and this time we are going to talk about men, but in a different way. Something that we all think about, we all talk about, and for many we do it also, and we are talking about sex. Okay.
All right,
Yeah.
that's very interesting.
Very interesting.
Okay.
I think this is a very important area because it affects not just in terms of our physical but also our emotional, and for some they will include that spiritual well-being. All right, so let's begin by talking about what are some of the difficulties that men face in this area of sex.
Okay. Well, thanks again for having me. So normally I would see men when those who come to see me in the clinic, they actually face problems. Majority will be erectile dysfunction. That's one of the common things that I see. Another common problem would be signs or symptoms of low testosterone, something like low sex drive or low mood, or also even not feeling the what you call that, even the erection is not that great. Yeah, so that's another major component of the patients that I see. These two are the common ones.
And what are some of the causes of these issues?
Okay, so for erectile dysfunction, it can range according to the age group, right? So generally, or maybe traditionally, we are looking at older men with issues of erectile dysfunction. So maybe those 50 years and above are at higher risk of erectile dysfunction. So erectile dysfunction is basically, it's not just about not being able to get hard, but sometimes not being able to be hard enough for penetration, or even for the satisfaction of both parties, like your wife, your partner, and yourself. So as long as the satisfaction is not there, can be considered as erectile dysfunction. So of course, for the older men, the factors can be a lot of things, including like chronic diseases, mental health issues. It could be also low testosterone. It could be lifestyle issues like maybe lack of exercise or poor diet. So there's a lot of factors, and most of the time, everything comes to play. It's not just one thing that causes it. So those are the things that may cause in the older men. But I do see younger men, even in their 30s and some even 20s. And there's another big group of men with erectile dysfunction, but it is mainly linked to more of a performance anxiety. So sometimes there's anxious, maybe it's a new relationship, or maybe it's somebody that they really like and then they get anxious for the first time, or just that it keeps happening. So that's another big thing.
So Dr. Mas, need to ask this question. All right, cyclists out there, listen up. Can cycling cause erectile dysfunction?
Okay. Well,
Why you laugh? Just like we talk about tight pants, tight everything,
Yeah.
and then when you sit down on the cycling seat, sometimes painful. Never use sponge. So it's a valid question, right?
Yes, good question.
It's a good question. I don't think there's any link of cycling or prolonged cycling to erectile dysfunction, but you may want to check fertility. Fertility may be affected for various reasons, like because there's constant pressure. Because your fertility is based on your testicles. There's constant pressure. There's constant heat. So it means that you won't be so healthy for the sperm. So that's something that you want to look into. But erectile dysfunction, maybe not.
I mean, do you have cyclists coming to you? I mean, say that I'm a cyclist, I do. I mean, so I put that that they are cyclists and coming with all these problems.
So far, I don't have issues of that fertility and they are cyclists, or maybe the cycling part did not come up. They did not say that they were cycling. But I've seen cyclists who have issues with the what do you call it, chronic pelvic pain, because they're constantly sitting, so there's a lot of pain and inflammation in that area. Yeah.
Do you cycle, doctor?
I do not so much.
So much.
I actually just got a bicycle recently. I
Ah.
think just got on the trend. Everybody's got a
Yeah,
bicycle.
yeah, right. It's almost sold out, no? Everywhere bicycle now.
Yeah.
And
So
the good ones.
yeah, so I just cycle, no, just for leisure. Nothing serious.
Okay.
Mm.
Yeah, going back to erectile dysfunction and the various solutions, right?
Mm.
Or low testosterone.
Mm.
The word that comes to me immediately is Viagra.
Mm.
Right.
Mm.
So is that the only solution, or is that being used widely?
Okay. So you're referring to the group of medication. In fact, Viagra is not the only medication. It belongs to a group of medication that works on the same inhibitor or same receptors. So this medication would be one of the first lines that we will prescribe for erectile dysfunction if it's really a erectile dysfunction issue. And actually nowadays it's not the only solution. We also have other things like there's a shockwave therapy. Yeah, so we have a machine that administers low intensity shockwave. There's no pain. There's no electrocution. There's no downtime. But what it does is that increase blood flow to the penis, improve circulation, and that helps with the erection as well. So there is another relatively new in terms of the last few years in terms of treatment for erectile dysfunction. We also have other things like injection, gels, but not as popular as the medication, of course, and also not as common. The shockwave so far also has been proven to be quite effective.
Wow, I didn't know all these things existed.
Yeah, now we know. Huh?
Mm-hmm.
Okay, so you can have his number later. I give you.
Wow, I don't need it right now. You never know.
You can never know.
Yes, you
Right?
never know.
Yeah.
Okay. Well, related to this, I think I don't know if it's okay to talk about this, but masturbation.
Mm.
Okay. There are different schools of thought. Different people do it for different reasons. Some say, it's a way to increase my manliness, and for those who are married, for example, they might resort to that, when for example, their wives are pregnant or having their periods, or their wives are not interested in sex. So they use that as their own outlet. From the medical point of view, what are some of the things that we need to know about masturbation?
Okay. I think growing up in our Asian culture and community, we sometimes criminalize masturbation a bit too much. So, but actually, it's actually a natural process where the body has to, or the man has to release the sperm or the semen from your testicles and your prostate gland. So it's a natural process because even if you don't do it, that's why you may have your wet dream and then you have your natural ejaculation at night as well. So it is a natural process, and some studies even may have shown that regular masturbation may help to reduce risk of prostate enlargement or prostate cancer. Although some say the studies are not validated, so it's a bit controversial in the area. But definitely it's a natural process for a man in terms of ejaculation.
So is there a definite medical advice on this?
You mean how often or whether you should do it?
You should do it, whether you should do it, because it's like sometimes people know because maybe certain religion, for example, prohibit it.
Yeah.
Okay. I mean, I think people sometimes they are not well informed and they just take it as no way, cannot. But again, biologically and medically, What does it say?
So in terms of if I relate it to just having sex, so it's recommended to have regular sex, like maybe about 3 times a week, similar to exercise, So similarly, ejaculation is also around the same duration and frequency. In terms of just normal sexual health.
So the other one is about, you mentioned I think quite a good point, regular sex, and this thing of regular sex, right? It's different for different people. And I'm gonna ask you what is the ideal or but definitely once a year is not enough lah. You're married,
Yeah, that's a problem if you
definitely there's a problem, right? You want every day also?
No, the every day will be too much.
Too much, right? I think for the men probably no problem, but the women, okay, maybe. Okay, because I mean, for reasons I think you just want to explain.
If you can do once a day, it would be good. But I think very few people can do that. Can keep up with that.
Right, unless you use Viagra every time, but it has side effect, right?
And of course, we all have so many responsibilities every day.
Yeah, no, I'm trying to relate that. You see, but if you have a healthy sexual life, your partner, right? Actually, with the right partner and a married partner, especially, right? That means emotionally you're bonded, and you have good emotional bonding and so on. So masturbation probably is not on the list or not on the table every time. Right. So again, it's about healthy sexual life. Yeah.
Yes, that's right. Yeah. So it's all about the healthy release of the ejaculation or in terms of the seminal fluid.
Yeah. Okay.
Well, talking about frequency of sex, yes, I think I've heard of this. 3 times a week would be a healthy frequency. But there are also people who say, that well, my wife or maybe even the guy, is the one that does not have any desire to have sex. So there are couples that maybe have sex less than once a week, So I think this can be a very sensitive issue, and a lot of guys will not talk about it. I happen to be in a Facebook group, and one of the fathers actually brought it up, right? And so, wow, there was a very interesting discussion on Facebook. I mean, the group is all guys, so obviously people are very open to talk about it. So I began to realize this is a very, very personal issue, but also a very real one. So people were asking, so what's the frequency? What should it be? Is it harmful to the marriage? And what can we do about it? So I was suggesting to them that, well, depending on your age, yes, there could be, and usually there is a decrease in your frequency in having sex, within the marriage. But there should be a kind of a minimum. There should be some regularity, because otherwise, I don't know. I don't want to be too jumping to conclusion, but you might want to check on your relationship. You might want to find out why. All right. If the guy is the one losing interest, why? Because that could also cause the wife to ask a lot of questions. What's wrong with me? Am I no longer attractive to you? And things like that. So I think what I advise that father is, whatever it is, whatever you're feeling, have an open talk with your wife, so that there is no room for such, suspicions and, speculations and all that. And it's also good to just share what you're feeling and what you're going through. A lot of people say, well, it's just stress, I'm just too busy. That's why there's no mood for it and things like that. Well, even so, even if that is true, talk about it. All right. Because being honest is also a way to build intimacy between husband and wife. And all right. And sometimes if we are too busy for it, just like couples have date nights, and I hope many couples still have date nights, plan for a sex date. All right. And the Dr. John Gottman, which I learned a lot from, and he's a relationship and marriage guru, he says, sex is the main event, but everything else before that is foreplay. All right.
Yeah.
So if you plan a sex date, on Tuesday night, for example, and so everything you do from Tuesday morning, all the way, is foreplay. All right. The messages you send, the words that you use when you talk to each other, and everything else, the things that you do for each other, all that is foreplay and leading up to the main event. I think another, some couples may be, especially guys, I think, when they want it, they want it. And when the wives are not ready, they don't get it. And so bitterness and resentment starts to build up, and that leads to further deterioration of the intimacy and things like that. So I'm just trying to kind of apply this whole topic to relationship, how it affects a marriage, how it affects your intimacy and all that, and what you can do and what you should do about it in order not to let your marriage suffer because of this.
Yeah, so I think with that note also, I would say I think some guys may be worried if how come I'm not hitting 3 times a week, or how come I'm only doing once a week, or how come I'm doing every day. So sometimes every couple is different, and sometimes if you both of you are really really happy with that kind of frequency, sometimes it could be good enough. But of course, if it's too little, then there's something wrong lah.
Correct. Yeah. I think as long as it is something mutually agreed upon, and both parties are happy with it, all right. And I think that's fine. That's why I said important thing is you talk about it.
Yeah, communicate.
Right? Communicate, share what you feel about it, how you're feeling right now, what are the struggles you have, because all this openness and honesty brings the couple closer together. So not just the sex, because even if you do it 3 times a week and you do it unwillingly, you do it because I have to do it, based on some expectations, you might have performance issues.
Yeah.
Yeah. So again, I think we have talked about this, about having a equal relationship between couples. You don't have that feeling that the male dominant mentality, that when I want it, I get it. It's like, you think about this is on-demand channel. This is
Netflix.
Like, Netflix. Like last time, we have TV channel, right?
Must wait.
Must wait, right? For our most favorite movie.
Once a week.
Once a week, Now it's anytime you can, maybe it helps in that kind of mindset. Yeah. So I think it's good that you have that kind of expectation, timetable in a way, not strict, but have some sense of a plan, and then everyone can be prepared and so on, not so sudden. I want to switch back again to the part on sexual drive and so on. Okay, and there's a research actually by Harvard saying that whether eating nuts may improve sexual function. I mean, they did a research.
Oh, I love
Yeah.
nuts.
Yeah, I happen to love nuts.
I'm nuts about nuts.
Because it's healthy to eat nuts. It's the natural snack, right? Yeah. So they did a research on some men, 83 healthy men, and to follow either traditional Western style diet without nuts, and another one with nuts with certain amount. And after 14 weeks, okay, men in the nut group reported improvement in sexual function, like sexual desire, quality of orgasms, compared to those in the control group. Okay, but did they say there's a disclaimer? It was not clear how nuts may have helped the men, but researchers suggested that nuts' high amounts of unsaturated fatty acids and antioxidants might be the factor. What do you think?
Well, I mean, sometimes studies we also must see how they do the study. But some of the things, it's been mentioned that nuts may help with libido because of the fatty acid and maybe some of the nutrients inside that could contribute to testosterone production. Possibly. But you don't want to come out here and say, okay, I'm going to eat nuts every day.
Yeah.
Then you also, too much of a good thing is also not a good thing. Yeah. So there's also other factors you must consider. There are so many other factors that goes into the sex drive, testosterone production. And one of the things that I always remind my patients is the lifestyle, overall lifestyle. Just now, previously we talked about health, right? So it's still important to eat healthy, maintain a healthy weight, have regular physical activity, and specifically like more of the muscle weight exercise or those muscle building exercises are more effective for sex drive than those cardio exercises. But of course, it's a good combination to have both cardio and weight building, muscle building exercises. Because the more muscle you build, the more testosterone you can produce.
Okay, so there's that correlation. What about meat? I mean, there's this thing about red meat. I mean, people think that eating red meat may cause higher testosterone level. Is it true?
I think it may contribute, it may help, but then it's not directly. So it may, when you eat more meat, then you have more protein. So more protein, more muscle. Then of course, if you exercise, then it will work lah. But if you don't exercise, then it will become something else.
Okay, you eat one cow, so it won't work.
Yeah.
No, you know what is the food that people usually
Yes, tell me, person. Your secret. Now that you tell me.
Not my secret, because this is one of those food that I don't like to eat.
Is it?
Oysters.
Okay.
Yeah. People say, well, oysters make you horny.
Aphrodisiac.
Yeah. Is that true?
Because it's one of the key vitamins inside is zinc. It's high in zinc. So that also contributes to the testosterone production. Yeah.
Okay.
But yeah lah. So if you don't like oyster, then
Yeah, I don't like any kind of shell, oysters, clams, or anything like that. Only if I eat it accidentally, then I'll eat
And
it.
you can't possibly eat it all the time because it's also high in cholesterol because it's a
Okay.
shellfish.
Correct.
So like I said, all these things may have good things, but you can't be eating it every day. You can't be eating nuts, so much nuts every day.
So you need to have a holistic,
Mm.
multi-pronged approach. Take care of your physical health,
Mm.
mental health, and then your sexual health.
Mm. So if you're looking at like vitamins and minerals, you can get it from a multivitamin. So together with a well-balanced diet. Mm.
Okay. What about some people? Maybe this is a bit funny lah. All right, they don't exercise but they take sex as exercise.
Okay.
They say having sex is like running how many rounds around
That's
the
why I must do every
track.
day or 3 times a day.
Is that true?
It is true because studies show that having sex burns a lot of calories. But also, if you look at, you can also ask yourself, how are you doing the sex? Some guys may just be lying down. I don't think you'll be burning a lot,
Yeah.
But if you are, you're actively engaging, you're moving, you're sweating, yeah, it's definitely exercise. But if you use that as an excuse for not exercising, and I think that's not right lah. So it's all about balance. There's certain exercises that will still be beneficial for you even when you do have regular sex.
Yeah.
Don't use it as an excuse not to exercise.
Correct. I don't think it's a complete replacement because not every muscle group in your body is involved.
Yes.
You haven't read Kama Sutra?
No.
Unless you finish the whole book lah, maybe lah.
Okay.
There's so many positions there. I don't think any of us can do it. Most of us can do it.
Most
Yeah.
guys just lie down.
Yeah.
Okay.
Interesting.
I think it's really good that we are so comfortable now to speak about sex. All right. Despite knowing that actually it's a podcast, people are listening. and you were saying about you have a Facebook group, right? That and
I'm
people start,
in a Facebook group. Yeah.
and people discuss, and men start discussing.
Yes.
So there's no harm, right? Actually.
This is I've been in this group for a number of years. This is the first time somebody brought up this topic. So we were quite surprised in a good way. We were, a lot of them said, "Wow, you're so bold to bring this up." So yes, I think we need to do that. More men need to do that, and somebody just needs to start the ball rolling and say, let's talk about it. Why hide it?
And actually, you're right. You're a medical doctor dealing with specializes in men's health and sexual. He's part of it, right?
Yes.
So this is definitely an area that I think you also feel. Is that the reason? What made you go into this actually?
No, I mean for men's health, is because I always find men tend to keep to themselves and not seek medical help. And when I speak to some of these men or my friends, a lot of times they are not comfortable with the doctor, so they feel uncomfortable telling the doctor about all these intimate problems or all these men's health issues because they don't feel comfortable. They feel that maybe the doctor is not interested or the doctor is judging them. So that's when I started to go into this field, and I feel that I'm able to make them feel comfortable enough to share their problems and help them solve their issues.
Yeah, I thought this is a wonderful becomes a passion for you, becomes a mission for you, it seems.
Yeah.
All right, and you start very young.
Yeah.
Anyway, Dr. Taufiq is very young. I think you're almost like double his age.
No lah, not double lah.
Yeah, you're below 30, right?
No, I'm not.
You're not. You look so young.
Yeah, that's right. How old are you
I'm
then?
almost 40. I'm
Almost
39.
40,
Yeah.
really?
I didn't know
Okay.
that. I didn't imagine that you are like your late 20s or early 30s.
Yeah, that's why I got experience.
Okay, now, how do you keep so? I mean, you're well groomed. It seems.
Yeah.
You know.
So like I mentioned, so I've also gone through the cycles of gaining weight and losing weight and being unhealthy and healthy. So it's a process. And at the same time, I'm also very passionate. Other than men's health, it's also about overall wellness, preventive medicine, and anti-aging in a natural way. So I myself wanted to go through it and not say experiment, but actually experience what are the things that I would advise my patients to do, so that I can be the example to tell them, okay, I've done this. This thing is, this is what you expect, or I've done this and okay, not so good, this is what I get, that kind of thing. So I want to be the good example for my patients, and I can advise them that you don't have to rely on medication all the time. Sometimes you can also do this and that at the same time with regular monitoring and regular health screening.
Right, you're unique in a way. I
Yeah.
mean, because people have this, expectation. Medical doctor always give medicine, right? Now you're talking about alternative medicine, and
Yeah.
going into there, again, there are many alternative approaches out there. May not be genuine. It may even be unbacked by any kind of evidence, right? So how do you manage that? And how do you advise your patients?
So it's natural to get my patients coming in and ask me, can I take this? Is this good? And all those things. So supplement is a big, huge industry. And a lot of supplements out there, especially from certain countries, when they just buy online. And then later HSA will find that they even contain certain medication or even steroids or even Viagra inside at high doses.
Wow.
No wonder they get very powerful because they put medicine inside. So a lot of times, especially when you buy online from unknown sources, you may not know what you're getting. So my advice would, nowadays information is available. So find out where is the source of the supplement, how they made it, whether there's any studies to back up the supplement. So more and more supplements are also going through studies, so you can read up more, and from there you can even ask specialists or doctors who knows about this kind of supplements so they can advise you what's the best.
Okay, one of the last question I want to ask. Don't mind, Pak Sen, does men go through menopause?
Yes, men go through menopause. In fact, I wrote an article in Berita Harian on this. It's called andropause.
Okay.
Yeah, that's the
All
medical
men?
term.
All men? Or
I would
at
say,
which age,
I would say all men because nowadays eventually because we're all living longer. So I cannot say some men don't, because when we live longer, eventually we'll hit it. So basically, it's not the same as menopause. So menopause is slightly different, but the concept is the same. That means there's a reduction of our main male sex hormone, which is testosterone. So as the age go up, the percentage of men with low testosterone is higher. So when you're 70, you're 70%, you have it. 80% have it. So that's the statistics. So yes, men do have menopause, and we call it andropause. But of course, you can seek treatment for it. So there's medication, there's treatment, and there are ways to so-called slow down or improve the symptoms.
Okay, so for women, is it like a point of no return, right?
In a sense,
it's like something like that, but men is not,
Yeah. So because for women it's slightly different, because when they have no more ovaries, the eggs, there are more eggs, then there's no more production. That's it. So it just stops. Whereas for men, we still can produce. It's just that it slows down.
It is the fertility side. But what the pleasure side?
Yeah. So the testosterone.
Yeah,
the
for men,
testosterone
right?
affects the sex drive.
Yeah.
Whereas for women, it just stops. The egg stop, but the hormone also stop. So the sex drive goes down lah. So whereas for men, it will actually not stop. It'll just slow down in production as we age. Yeah.
I should reflect upon that. Why men are given that responsibility, all right, to still have the sexual drive until almost old.
Yeah.
Not
I think that also reminds me of this point that God willing that you are still married at the age, and by then sex cannot be the thing that ties you together and keeps you together. Some other things needs to be, and so I guess it's your relationship, your love for one another, enjoying life together in old age. Because when I meet couples who are going to get married, I help them with their marriage preparation, and when one of the questions I ask them is, why do you want to get married? Oh, so I have someone to grow old with. Okay, that's a good answer. So I hope I wish you all the best, but sex is something that will become less and less of a profile and feature in that marriage as you are in the 60s, 70s, 80s, if you do live that long. So we all need to build our marriage on something else besides sex
Mm.
as you grow old.
And also testosterone is not just for sex drive. So testosterone is a hormone that also has a lot of other health benefits.
Mm-hmm.
You know, it's good for your heart, good for your muscles, good for your bones even. So it's also a very important health benefit of having testosterone.
All right, Dr. Taufiq, we had a very good talk again with you. All right, I hope you enjoy this talk and we'll
Yes, I
come
did.
back
Thank you.
because there are a lot of things I think we had to stop because of sake of time.
Okay.
But we hope that you can share more.
Thanks for having me.
All right,
See
thank you very
guys
much
again soon.
for being here.
Thank you.
Right. Thank you. Bye bye.
Bye.